Have you ever cracked your knee and wondered what's happening inside? Knee cracking can be a curious and sometimes concerning phenomenon. Knee cracking can be caused by various factors, including gas buildup in the joint instability, muscle tightness, overuse or repetitive strain, underlying conditions like osteoarthritis. It can be treated by physical therapy to strengthen surrounding muscles, joint mobilization techniques, pain management through medication or injections, and exercise. While knee cracking may seem harmless, it's crucial to address underlying issues to prevent potential damage and maintain healthy knee function. Consult a healthcare professional if you're concerned about knee cracking or experience persistent pain. Take care of your knees, and they'll take care of you.